All right, today we are diving into something huge, a topic that's genuinely going to affect every single one of us, the European health data space. Now, this thing is ambitious, it's pretty complex, and honestly, it plans to completely revolutionize how our health information gets used across the EU. So, let's get into what this really means for you and for the future of healthcare in Europe.
I mean, just think about it for a second. You're on holiday, maybe a business trip in another EU country, and all of a sudden you get sick. You walk into a doctor's office and they know nothing about you. No idea about your allergies, your medical history, the medications you're on. That kind of situation is, well, it's stressful at best, and it can be downright dangerous at worst. Because the reality today is that our health data is, for the most part, fragmented. It's trapped, it's stuck in different computer systems, in different hospitals, in different countries, and most of the time, they can't talk to each other. And this creates some real problems, you know? You've got doctors working with an incomplete picture, patients having to redo expensive or annoying tests. It just slows down getting the best care possible. So to fix all this, the EU is building what's called the European Health Data Space, or EHDS for short. It's a massive project, really, designed to create a single market for health data. And the whole plan is built on two really big goals. First, to give you better care and direct control over your own data. And second, to harness all of our collective health data to speed up medical research for everybody. Okay, so this is the key thing to get. The EHDS has these two pillars. On one side, you've got primary use. Just think of this as your data working for you. It's all about making sure you get better, safer care no matter where you are in the union. Then, on the other side, there's secondary use. This is about pooling anonymized health data for the greater good. Things like scientific research, smart public health policy, and medical innovation. It's about using our shared protected knowledge to solve the big health puzzles. So let's start with the part that's going to affect you most directly, primary use. This whole idea is about making your health data mobile, accessible, and ready to help whenever you might need it. Let's go back to that scenario we talked about. With the EHDS, when you get sick abroad, a local doctor can, with secure access of course, instantly pull up your essential health summary. They can see your prescriptions, any major allergies, key diagnoses. Now, this isn't about them reading your entire life story. It's about giving them just the critical info they need to treat you safely and effectively, right there on the spot. You can see right away how this could help avoid dangerous mistakes or redundant tests. So how in the world does this actually work, technically? Well, think of it like this. Right now, every country's health system speaks a different digital language. What the EHDS does is create a universal translator, a common format for electronic health records. This means a patient file from Portugal can be instantly and accurately read by a system in Poland, finally breaking down those digital walls that have been there for so long. And the ambition here is, well, it's massive. The goal is nothing less than 100%. And nope, that's not an exaggeration. The plan is that by 2030, every single citizen in the EU will have free, immediate, electronic access to their own key health records. It's a huge shift, and it's all designed to put you firmly in the driver's seat of your own healthcare. The giving you control of your own data is really only half the story. The second part of this is where we zoom out from taking care of one person to improving the health of our entire society. This is the secondary use piece, and it's all about unlocking the incredible potential of health data for research and innovation. So what does secondary use actually look like in the real world? Well, it means researchers can get access to huge anonymized data sets to develop new cancer treatments. It means that data can be used to train an AI to spot the signs of a rare disease years earlier than a human doctor ever could. It means policymakers get the information they need to react effectively to a pandemic. It's really about turning all this data into a powerful tool for the public good. And the regulation itself puts it very plainly. The whole point, the stated aim, is to create real benefits for society. We're talking new medicines, better medical devices, and improved healthcare for everyone at fair and affordable prices. That's the ultimate payoff for creating this trusted system of data sharing. Okay, now this part is absolutely critical because the second you start talking about sharing health data, people rightly ask, what about misuse? And the regulation is incredibly blunt about this. It is explicitly forbidden to use this data for things that would harm you. So an insurance company cannot use it to jack up your premiums, a potential employer can't use it to screen you for a job, you won't be targeted with ads based on it. These are hard lines drawn in the sand to protect every citizen. And that brings us to the absolute core of this whole thing, trust. A system like this only works if people feel their data is safe and their rights are protected. So let's look at the specific safeguards that are being built right into the EHDS.
The entire system is designed to put you in control. It builds on the rights you already have under GDPR, but it adds more. You have the right to get an electronic copy of your key health data instantly and for free. You also get the right to restrict access, to say, I don't want this particular information shared. And, this is crucial, for that secondary use, the research part, you have the right to opt out. You can say, thanks, but no thanks. I don't want my data included.
So how is the data for research actually kept safe? They're using something called a secure processing environment. The easiest way to picture this is like a digital safe room. Researchers are allowed to go inside this room to analyze the data, but they can't take any of the raw data out with them. They can run their models, do their analysis, but the only thing they can export are the final, summarized, non-personal results. The individual data never, ever leaves that vault.
All right, a vision this big obviously needs a serious technical and organizational backbone to make it all work. So who's actually going to run this whole thing and make sure it stays secure? The whole structure is split pretty logically, just like the two uses of data we talked about. For your personal, cross-border healthcare, the infrastructure is called MyHealth at EU, and that's overseen by the Digital Health Authority in each country. Then for the research side, the infrastructure is called HealthData at EU, and access to that is managed by new, dedicated health data access bodies. Think of them as the trusted gatekeepers for any research request. And there's one more really important layer of security, this time for the technology itself. All the electronic health record systems that are sold in the EU will have to be certified with a CE mark. It's basically a guarantee, a seal of approval, that the software meets high European standards for security, safety, and its ability to connect with other systems. It ensures the entire ecosystem is built on a foundation of trust. So if you bring it all together, the European health data space is really this vision for a future where our health information is no longer stuck in these isolated little boxes. It's about creating one connected system where your data can flow securely to improve your own personal care and, with your trust and strong safeguards, contribute to medical breakthroughs that can help us all. And that, of course, leaves us with the big question, doesn't it? The EHDS promises a brand new era of smarter healthcare and faster medical innovation. But it also requires a level of data sharing and trust that is pretty much unprecedented. So, is this the dawn of a healthier future for Europe, or is it a new frontier of challenges for our personal privacy? The answer really is going to depend entirely on how well all these ambitious rules and safeguards are actually put into practice. It's a space we'll all need to watch very, very closely.